People are dying now. The deaths are climbing at a rate that's really frightening. 65,000 Americans died last year from drug overdoses. In Maine, 418. That's up 11% from the year before and 40% from 2 years earlier. The death rate keeps going up. The number of babies being born drug-affected keeps going up. 25% of adolescents are using drugs, mostly alcohol and marijuana, but 10% are using opiates. And the fishing community is way overrepresented. It's out of my patients, whenever I have 100 patients, at least half were either fishermen or family members from a fishing family. And they don't represent half the population, maybe a tenth. So it's really bad in the fishing community, and even worse on the islands where fishing is the main industry. So I got certified to treat with a medication called Suboxone, which is a treatment that's very effective for opiate addiction. And I just started treating a few people, and then it turned into more people, and then I got up to my limit of 100 people. Finally, after 7 years, my tenure at Penn Bay was coming to an end, and I still had 100 people, and they were frantic because addiction being a chronic disease and treatment being long-term, and the consequences of not having someone continue your treatment is very terrifying. 85–90% of my patients had no health insurance, so they had to pay for everything out of pocket. The doctor's visit. The medication itself could range anywhere from $100 to $500 a month. And then there was the counseling on top of that, and they saw the counseling as the part that they either didn't want or didn't feel they need, and they certainly want to have to pay for it. So I was getting 3 or 4 phone calls every day, 365 days a year, year after year. And so if you just take 1 year and do the math, that's more than 1,000 people. And we know that not everybody who has addiction wants treatment or is ready for treatment. So you can double that number and say there's probably 2,000. I'm the founder of the Midcoast Recovery Coalition. Our goal is to reduce the rates of drug addiction and its consequences in Midcoast, Maine. How do you reduce the rates of drug addiction? You create a very healthy environment where the parents feel supported, where the schools are very involved, if they're surrounded by people who love them, support them, help them get their lives back on track, help them get good work, a healthy place to live. They don't need a drug. A drug can't compete with that. One of our taglines that we use frequently is, a healthy community is stronger than any drug. So we have special programs to help inmates. We have programs for young families where the mother has just had a baby while the mother wrestles with addiction herself. We're trying to roll out programs for teenagers by working through the schools. We have programs just for individuals. We call it Helping Individuals in Recovery Succeed. We do need more recovery coaches. Many of the recovery coaches are not people in recovery. They're recovery allies. They just want to help. They're good, well-meaning people who want to help out. We know we're on the right track, but we know we need more people. We need the support. We need the financial support. We need the physical support. We need the organizational support. But it's coming. We know it's coming. But we need to persevere.